Hello, and welcome to Ask Dr. Dawn. The opinions expressed in this program are those of the speakers, and this is a program intended for education and entertainment. It should not be construed as a substitute for a medical consultation. So I have an announcement, and this may interest some of you, those of you who don't have so much chronic low back pain that you can walk, or those of you that live to our neighbors to the north in the immediate San Francisco Bay Area. It's a little far to drive for some of us, but I do want to announce that there's doing a study up at UCSF, and they'll be still recruiting for people, psilocybin therapy for chronic low back pain. And it's looking at using psilocybin for helping with the psychological and emotional symptoms of distress associated with chronic pain. Investigators will determine whether psilocybin therapy improves the patient's ability to cope with chronic low back pain. And I guess they're looking to incorporate that into future studies. How do you qualify? Well, you have to be between 25 and 70 and write in English, have chronic low back pain, and be able to attend all the in-person visits at UCSF as well as virtual visits. And you have to have tried at least 2 previous medications or procedures and physical therapy for your low back pain. So go ahead and take a look that they are accepting patients. And let's see. The sponsoring researcher is Joshua Woolley, Woolley. And there's no website on this. I just got an email about it and thought I'd share it. But I think if you just call and ask for Joshua Woolley with an L, 2 L's and an EY, MD, PhD, you'll probably find the right department and find out if you can get an application for the study. Good luck on the internet. You might find it there as well. So let's pick up that caller that is hanging on, I hope. Hello, welcome to the program. Give us your name and where you're calling from.
Brian, and I'm calling from Santa Cruz.
Well, hi, Brian.
And a years-long fan of yourself. And I have a quandary at the moment. I'm getting ready to have 83 years old male, getting ready to have a urologic procedure. Doc says we usually do a spinal for this, but because you have low platelets, I don't think a anesthesiologist will be brave enough to try that. So it will have to be general anesthesia, put you all the way under. Last time I went under, the only time I ever went under was terrible coming out. So I'm looking at 2 things. One is I also stumbled across epidural as an alternative to spinal. And also in general, what's the best way I can work with my anesthesiologist whenever it is identified on this procedure coming up soon here?
Remind me of the procedure.
Going after some stones in my bladder.
Bladder stones. Okay. Well, yeah, you definitely could do that under a spinal if you could go under a spinal. How long ago was the surgery that you had general on?
11 years ago.
And was it at a local hospital?
Dominican.
All right. So you probably can they probably can pull your surgery records. I think those are all electronic. Back when we had paper records, we gratefully shredded them after 8 years. That's the statutory limit. But I suspect with something like your operation and your anesthesiology records, you may be able to pull that record. And for the audience in general, if you have a bad anesthesia, you want to know what they gave you, and you don't want to take that again, because there's lots of alternatives that they can use if they have a history of a bad reaction. So it would be good to find out what it was.
Yeah, I have that in paper.
Well, excellent.
I collected it at the time because I was so distressed that I wanted to, what the heck happened? And it turned out there was something like 17 different substances were included in my anesthesia.
Well, yeah, but there will be ones that cause characteristic side effects, and so they'll be able to kind of steer around it, I think. So it would that kind of information is going to be really important. Now, what were your problems? Were you just out of it for a few days afterwards, or did you?
Yeah.
Okay.
Well, a total disorientation for a period of time, number of hours, and then out of it for a couple days afterwards. Yes.
All right. And this bladder stones doesn't sound like an emergency. So
No.
One of the things that you could try to do is get the detoxification enzymes in your genetics checked. And that'll take, turnaround time for that, depending on who you use, could be 3 or 4 weeks, tops. But then you'll be able to work with the anesthesiologist and say, okay, I'm weak with my my N-acetylation enzymes are poor. So what have we got that can be broken down through a different enzyme system? And there are the acetylation and slow acetylators is something, it's like the first detox thing I got taught about it way back when, because when people have this gene really badly, they don't wake up from anesthesia for like 3 days, and it just freaks out everybody. And I mean, they don't wake up. You can't get them even conscious. And then they eventually burn through the anesthetic. But that's like the extreme case. And there's, the extreme cases are the ones that end up getting named as diseases. But it's all gray area in our bodies. And so
Can my doc steer me to how to get my detox enzymes checked?
You probably want me to help you with that. The outfit I usually use is called 3X4 Genetics, and they're from South Africa, but they have an American unit. And I think if you just go and look at that website, search for 3X4 Genetics. You can call me back next week if you don't find it. But I think the browser will probably turn it up. And then you can take that. I think they need a doctor's order. You can take that to your doctor, or you can take it to, you can, come to my office and, I'll charge you a brief fee and I'll order it for you and then help you understand the results. And then you'll just basically take that to the anesthesia people, and they'll work with the pharmacologists at the hospital to sort this out. And,
Excellent.
They want to avoid this. And having a patient come to them with this might actually move them out of their cement shoes to kind of move a little bit forward into modern genomics and how it can really help us with dealing with patients with a history of a situation like this.
Great. Thank you very much, Doctor. These are exactly what I needed to find.
I'm so glad I was able to help. You keep listening now, okay?
Thank you.
All right. Bye for now. Well, that brings us to our first story or first discussion tonight. And we're going to talk a lot in the beginning of the show about sound. Let's start with the positives. A clinical trial found that listening to specially designed music with auditory beat stimulation. So they use different lengths and different frequencies of this, and this specially designed music is, soft kind of new agey, relaxing music, but then it's paired with something called auditory beat stimulation. Auditory beat stimulation is the same as binaural beats. Basically what happens is you're wearing headphones and the music is coming in, and one side is very, very slightly delayed. And so we're talking about a delay of possibly as little as a quarter second. So you really don't, usually the delay is much less than that. So we're talking about, a 13th of a second. But when it hits one ear before the other, something interesting happens in the brain. The brain hears the one and then the other, and it generates a brainwave that propagates with the music. So you get basically a sine wave that is the difference between the two sounds. So if you run the sound slowly, like theta waves, which would be 4 to 7 hertz, so if you change them by 4 beats per second, that's going to create a 4 hertz wave in the brain, and that will be enough to generate deep sleep and deep relaxation. If you use a 13 to 30 hertz, which is, of course, a faster beat, you're going to get a shorter distance between the two, and that actually is a stimulator and improves focus and concentration. And these have been showed in numerous scientific studies. So the question is, well, hearing a bunch of statically little beats isn't going to work for people, so you've got to give them something they can listen to. And they were specifically targeting a anxiety issue. And this was they were working with the company that makes digital therapeutics called Lucid. And this is a spin-off that came out of Toronto Metropolitan University. And nowadays, when you discover something, the first thing you do is spin off a company. And the same is true up there in Canada, I guess. So anxiety is a big deal around the world, and we can use medications, we can use cognitive behavioral therapy, but there's a lot of face time and transportation issues, long waiting time to get into a person, and as far as medications are concerned, side effects and concerns for addiction. So researchers have been looking elsewhere, and music-based digital therapeutics has been very promising, and there are lots of music tapes. I must have been 20 years ago. I went to a sound and healing conference in Santa Fe and learned about binaural beats. And I think I went home with a couple of CDs that I played through my headphones. How primitive. But they did 144 adults in the study, and they all had moderate trait anxiety, and they were already taking medication. And they got one of 4 listening conditions, which first one being pink noise, which was the control. The second, I think they should have had control music. I'm critiquing that. Okay. The second was 12 minutes of music with the ABS. The second was 24 minutes, and the third was 36 minutes. And then they completed some tests, and they looked at whether they were more relaxed after the sessions. And the 24-minute, not the 36, was the best one. It was the strongest overall reaction, and obviously a little bit more efficient. It was long enough to meaningfully shift anxiety levels, but not so long that people needed to carve out more than half an hour to do it. So something likely to reach adoption. If you haven't tried binaural beats for relaxation or anxiety, you can go looking and find many probably downloadable things that you can purchase or rent and try. I strongly suggest, if you haven't given this a try, that you do it. I think it's an effective form of technology for many people. And this study was just a little bit of nuance, trying to make sure that they knew what the best time for that would be. And so 24 minutes of binaural beats, and you may be sleeping through the night. Wouldn't that be wonderful? And let's go to more about noise. Back at the turn of the 20th century, a very famous physician and bacteriologist named Robert Koch, Koch, predicted that one day men will have to fight noise as fiercely as cholera and the plague. Well, it's taken more than 100 years, but that is definitely what is going on. Chronic noise exposure disturbs sleep, impairs cognitive function, increases hypertension and cardiovascular disease, and adversely affects outcomes among hospital patients. Traffic noise at night causes fragmentation and shortening of sleep. elevation of stress hormone levels, and increased oxidative stress in the vasculature in the brain. Sound in the ears causes oxidative stress in the bloodstream. Think about that. These factors can promote vascular dysfunction, inflammation, hypertension, and thus elevate the risk of cardiovascular disease. There's high-quality evidence for links between noise exposure, ischemic heart disease, and higher cardiovascular morbidity and mortality. If more noise means more disease, well, can we prove that? It can be difficult because lots of factors influence disease risk, and it's often true that people who live and work in the noisiest environments are also exposed to more airborne pollutants, road noise, microparticles or nanoparticles of tires, right, going into your lungs and your nostrils, and chemical toxins. And of course, if you're living right next to a road, you may also have a lower income bracket and have a worse diet and a more stressful lifestyle. Nevertheless, research definitely has looked at noise impacting human physiology, and a lot of work has been done in laboratory settings to both measure ambient noise, and it's not just big, loud factories that we have to worry about. Just take a moment and consider how many devices around you are beeping, bleeping, ringing, and buzzing over the course of a day. Or the low-grade, my office is on Mission Street, the low-grade constant traffic noise and the occasional testosterone toxic individual with a motorcycle or a car with no muffler, fire engines, the firehouse. I'm happy the firehouse is nearby most of the time. These factors are more subtle and harder to quantify than high decibel factory or construction noises, but they do accumulate. So let's go to the work of Rick Nitzel, PhD, head of University of Michigan's Exposure Research Lab. Dr. Nitzel and colleagues track the impact of ambient noise in common day-to-day settings like offices, restaurants, places of business, the sort of annoying, low-grade, unwanted sounds to which people are constantly exposed as they live their lives. And they're correlating the sound data now that we have the technology to do this with real-time biometric data. You're sitting there with your heart rate variability monitor and your pulse monitor and your oxygen monitor wrapped around your wrist, which also takes dictation and makes phone calls for you nowadays. We can get a very detailed and nuanced picture of how intrusive sounds affect physiology and disease risk real time. Right now, they're collaborating with Apple on a comprehensive hearing study using the AirPod devices. So they'll measure the headphone and environmental sound exposures over time and determine how these exposures impact hearing and stress levels. And of course, we have ways of measuring stress levels that are very scientific. Salivary cortisol, heart rate variability, these are things that have been highly validated. And a new threat. The world is getting more noisy, not less, and it's happening quickly. Certainly there's lots of construction going on, but the big concern here are data centers and server farm. So we know, and we've heard of discussions of how these squat concrete server farms devour energy, but they also emit an incredible amount of noise into the environment. And the culprit here is heat. Heat is both a waste product and a lethal enemy of data processing hardware. So the servers have to be blasted by noisy cooling systems 24/7. So that noise was not a general public health concern when it was out in rural areas, although it would obviously affect people who worked in the facilities. But now, the areas with the highest levels of concentration of data centers are trying to push back and pressure elected officials to hinder or block the construction of new facilities. The areas in Virginia, south of Washington, D.C., are some of the most noise polluted and server farm dense areas in the nation. And there is a noise gap. Noise disproportionately affects poor people, especially in population-dense urban environments. And let's talk about the noise gap. Along with airborne pollutants, communicable pathogens, and other detrimental environmental factors, poor people are exposed to a lot more noise, and they're a lot less able to insulate themselves from it. The UN has recently identified noise, transportation noise, as a contributor to cardiovascular disease, including MI, stroke, heart failure, and arrhythmia, and has issued pronouncements that we would like someone to pay attention to. But mechanistically, the data is there to show that noise exposure triggers oxidative stress, inflammation, endothelial dysfunction, that is to say, dysfunction of the lining of the blood vessels, circadian rhythm disruptions, and these all involve mitochondrial dysfunction, the oxidation of NADPH, and the decoupling of nitric oxide synthase, which is happening because of oxidative stress in the blood vessels. And so those who have pre-existing cardiovascular disease are very highly at risk. So thinking about this, I always go to, all right, what's the solution? We are currently having housing development forced down our throats, and it's because it's been delayed so long, it's very dense right now in my area, and a lot of people are just, change is hard to adjust to, and when it happens really quickly, it's harder to adjust to. That's just being human. I went looking for what are the cheapest, good noise-canceling headphones, and I read through some reviews this afternoon, and the one that comes up as the cheapest, and you can get it for between $60 and $80, is Anker, A-N-K-E-R, Soundcore Life Q20i. Go and put that in your search engine and think about maybe a gift for your dad or your mom if they live near or in a noisy facility. You might just be prolonging their life. And maybe if they have some anxiety issues, you can get them some binaural beats to play through those headphones and get a twofer, as they say. Here's a question from John in Switzerland. Hello, Dr. Don. My name is John. I'm a U.S.-born Swiss transplant and a 30-year friend of Bob in Maryland, whose question you featured in your last podcast. Bob suggested I write to you directly. I write to you as a 19 years Crohn's patient seeking guidance. In order to keep this brief, I won't bore you with my disease history, other than to say that lower GI bleeding, depression, body pain, and memory loss have all featured prominently in my journey. I had 6 months of perfect health in 2024 going into 2025, but due to a nonsteroidal anti-inflammatory induced flare in June 2025, I'm now experiencing super scary symptoms: speech arrest with preserved awareness, episodic amnesia, transient visual disturbances, spatial disorientation and dizziness, and mild intermittent hand tremors. My question: Switzerland hasn't yet adopted the functional integrative approach like other developed countries have. To the Swiss medicos, one's family doctor is perfectly suited to fill that role, but in reality they can't. As a result, I'm finding it very difficult to find any doctors here that are even aware of the gut-brain axis neurogastroenterology. Do you know how or where I might find doctors with this specialization in Switzerland, or can you plug me into a group or a resource that can? Well, I can plug you into a group, John, and I would strongly recommend that you send an email to the functional medicine people, and they have a registry of all of the doctors who are certified or have come through any of their educational programs and cross-reference to their specialty. So they may be able to find you a functional medicine doctor in Switzerland, because we do get people from all over Europe and all over South America at our conferences. So I would certainly ask them if they have any Swiss doctors they can suggest to you. I would also point out a few things about your symptoms that really concern me. Now, you mentioned that memory loss is featured prominently, and that is probably coming from inflammation of the brain that's being caused by the translocation of lipopolysaccharides, basically fragments of dead bacterial cell wall that are diffusing across your damaged and inflamed gut lining, and then activating the immune system, because the gut is surrounded by a very large immune system. And that immune system, even in a well-managed gut, can easily be activated if you eat an awful lot of something, or if you use alcohol, or if you use ibuprofen or other nonsteroidals. You can get enough leakage that you will activate the immune system and create oxidative stress, just like that noise pollution we were talking about earlier in the program. There is, in Crohn's disease, a specific neurological syndrome called chronic inflammatory demyelinating polyneuropathy. And this is a syndromic pattern that, for whatever reason, is very characteristic of Crohn's. It's a cross-linking of the Crohn's antibodies with the formation of antibodies against myelin. And so what happens is you develop almost a sort of multiple sclerosis type syndrome. And that typically is going to be muscle weakness and numbness and pain in the arms and legs, this particular syndrome. But it sounds to me like perhaps the inflammation in your brain has moved up to the next level. And it is, in fact, very possible that what you're experiencing, or at least some of it, is actually some form of seizure activity. So I think the transient visual hallucinations and the speech arrest with preserved awareness should be enough to get you an EEG. You may have to go through, please refer me to a neurologist. I think I'm having temporal lobe strokes. Then, that's your key phrase, and then you describe the visual disturbances and the speech arrest. The speech arrest is a really weird symptom. It's not like, I can't remember the word. It's like my mouth won't move, but I'm aware and I can't say anything. That's how I'm interpreting it anyway. The tremors aren't going to impress anybody. Spatial disorientation and dizziness, while very unpleasant, are very nonspecific and, again, won't be impressive enough. But those other things, definitely you should be able to leverage an EEG, a sleep-deprived EEG, and maybe an MRI scan. I think you need those. So work on getting through the system as a atypical seizure disorder to get those studies done. And that may, in fact, be what you've got, because people with Crohn's disease do get seizures more often. Again, brain inflammation. Inflammation, not money, is the root of all evil, at least so far as medicine is concerned. All right, moving right along. Scientists at MIT have discovered a little-known protein called interleukin-2 that plays a powerful double role in defending the gut. See how cleverly it ties into the earlier email? The moist surfaces that line the body contain specialized molecules that help defend against microbes and prevent infections and inflammation. Among these protective molecules are lectins, a group of proteins that identify microbes and other cells by attaching to sugars on their surfaces. Researchers at MIT have now identified one lectin with particularly strong antimicrobial effects against bacteria living in the GI tract. The protein, called interleukin-2, attaches to sugar molecules on bacterial membranes. This interaction traps the bacteria and slows their growth. The protein can also link together components of mucus, thus reinforcing and hardening the mucus layer that protects the gut lining. What's remarkable is that interleukin-2 operates in two complementary ways. It helps stabilize the mucus layer, and if that barrier is compromised, it can directly neutralize or restrain bacteria that begin to escape. Evidence suggests that the human genome encodes more than 200 lectins, which are carbohydrate-binding proteins involved in immune defense and communication between cells. Some people may have come across a website from a doctor who's made a name for himself saying that lectins are the root of all evil and we shouldn't eat any of the pulses, which is to say things like lentils or beans, because they contain lectins, and lectins are bad, bad, bad. Well, as we say, immune defense and communication between cells, if you're receiving the wrong communication from the lectins because your receptor is misinterpreting the signals, possibly that could account for some of the adverse symptoms that this doctor describes. However, it's a small minority of people that are reactive to lectins in this way, and they are certainly not the root of all evil, as we see from this article. In humans, interleukin-2 is consistently produced by the Paneth cells in the small intestine. In mice, it's actually produced by different cells, showing that it's important. But in both species, it binds to a sugar molecule called galactose, and this sugar is commonly found in mucins, the gooey molecules that form mucus, and the mucus layer of our intestines is critical to protecting us from, among other things, the translocation of those lipopolysaccharides from dead bacteria or live bacteria themselves if they have. Mucus is your friend, and it also secretes IgA, an antibody that attacks bad bacteria. So love your mucus. This is also happening in your nose. When interleukin-2 attaches to these mucins, it cross-links them together and sews them up and strengthens the mucus barrier. But it'll also attach to the galactose on the surface of some bacterial cells. And these include several pathogens like Shigella and Salmonella, which are known to cause gastrointestinal infections. So over time, the trapped microbes begin to break apart. Somehow, interleukin-2 disrupts their cell membranes and ultimately kills them, although the mechanism for that is not known. In people with inflammatory bowel disease, like our emailer, levels of interleukin-2 can become either unusually low or unusually high. Reduced levels may weaken the mucus barrier, while excessive amounts could eliminate beneficial bacteria that normally inhabit the gut. Oops. Friendly fire situation, so to speak. Researchers suggest that therapies designed to restore balanced levels of interleukin could be very helpful to patients with inflammatory bowel disease. Findings show just how critical it is to stabilize the mucus barrier. Looking ahead, we can imagine exploiting these lectin properties to design proteins that actively reinforce that protective layer and possibly also provide some pharmaceutical company with a suitable profit margin for the quarterly income report. I have a news of the weird for you. A critically ill 33-year-old man survived an almost unimaginable scenario, living for 48 hours without lungs, thanks to a groundbreaking surgical approach. After a severe flu-triggered infection destroyed his lungs and caused multiple organ failures, doctors removed both lungs entirely. They had to stop the spread of infection. In their place, they used a specially engineered artificial lung system to oxygenate his blood and keep his body functioning while he stabilized. You can't survive without your lungs, or at least you couldn't until now. This report was published in the Cell Press journal Med. The surgeons described how they removed the lungs and using a technology called ECMO, created an artificial lung system to keep him alive until a double lung transplant could be performed. The man, a young man, developed acute respiratory distress syndrome, a dangerous condition in which inflammation and infections overwhelm the lungs. It began with the flu, and then he got a bacterial pneumonia. I'll just take a moment and say this is why you want a flu shot. He's 33, he's healthy, he gets the flu. Probably Staph aureus, which basically turns your lung into pus, got in there. and staph pneumonia almost never occurs except after influenza. The sign of that is you have the flu and you're starting to get a little bit better, and then suddenly you spike a fever and start coughing worse. That scenario needs an immediate chest X-ray. That means, if you get sick during the recovery period from influenza, you're at risk for this kind of bacterial pneumonia, and it can literally melt your lungs, like it did in this man's case. Once you have the lungs liquefying, the amount of dead bacteria that are being generated by the immune system, and this high activation of the immune system fighting for his life, all of that debris and breakdown product and acid and pH shift begin to overwhelm the heart, the lungs, and the kidneys, and he began to develop multiple organ failure, which is usually death. But at that point, the only way to stop the multiple organ failure was to take the lungs out now. The lungs were actively contributing to the spread of infection, but he was too unstable at that point to handle a transplant. He was in shock. The doctors needed time to stabilize him. So, like I said, they hooked up an existing bypass system that we used called extracorporeal oxygenation and kept him going. The system oxygenated his blood, removed carbon dioxide, and supported circulation so the heart and the other organs could keep going, even though at that moment the guy had no lungs. Once the lungs were removed, all of that bacterial debris no longer had to be detoxified. The burden on the patient improved, his blood pressure stabilized, his other organs started recovering, and the infection came under control. That took 48 hours of intensive care. Within that time, double lungs became available, donor lungs, and they successfully completed a double lung transplant. That was 2 years ago. This patient is now alive with healthy lung function. Lung transplant is usually reserved for people who have chronic conditions like interstitial lung disease or cystic fibrosis. Usually when people get severe ARDS, you just keep supporting them and the lungs either get better or they die. But molecular examination of his removed lungs showed that his tissue could not have recovered. So they made the right decision, and fortunately those donor lungs became available. One ICU specialist, pulmonary specialist, is Dr. Barat, who was involved in this surgery, is quoted as saying, "In my practice, young patients die almost every week because no one realized that transplantation was even an option. For severe lung damage caused by these sorts of infections, a lung transplant can be life-saving." So we may be seeing more of those as time goes on, and people now realize that that is an option for ARDS. Once you get shock lung or ARDS, no matter how healthy you are, it's a coin flip whether you'll survive. So probably not news to anybody, but a major scientific review has found no evidence at all that acetaminophen, the active ingredient Tylenol, raises the risk of autism. This was a meta-data study, a meta-analysis. They looked at 43 studies involving millions of births. They found no clinically important increase in the risk of autism, ADHD, or intellectual disability. This goes against President Trump's recent claims of a Tylenol autism link and his argument that pregnant women should tough it out rather than take the painkiller. Medical groups have rejected this because fever during pregnancy causes birth defects and can endanger the mother as well. Controlling fever during pregnancy is critical, appropriate obstetric management, and saying and having someone, with the rapidly vanishing credibility of the President of the United States saying something like that may actually have led to adverse consequences somewhere. I sure hope not. But this new analysis excluded the low-quality studies and gave more weight that tried to account for genetics by comparing siblings born to the same mother. So in other words, if you already have an autistic sibling, you have a genetic risk. So if you have that, you would take that person out of the study with the idea that that would be a confound. The only way you can control for that is only count people whose mothers took acetaminophen who don't have siblings already with autism. Another brief note to share with you. We were talking earlier about sound. Before you lie down to do your binaural beats for 24 minutes to relax, you might want to consider a cup of tea. Tea possesses a drug called L-theanine. It's thought to boost both dopamine and serotonin, lifting your mood and also helping you relax. Black teas also have some L-theanine, but green tea is probably the better one to drink, and here's a couple of reasons why. There was one striking paper published in 2019. They looked at people 50 years and up, about 3,500. They adjusted for smoking, coffee, and other variables, and they had those who drank green tea scored higher than black tea drinkers on a successful aging health index that assigned scores for things like body weight, health, levels of physical and social activity, and that's thought to be because green tea has about 30% more per cup than black tea does. This is because in the production of black tea, the tea is allowed to ferment, and the fermentation shifts the amounts of L-theanine. When consumed regularly, it seems to reduce stress and seems to improve sleep. It takes about 200 milligrams, which is the amount in 8 cups of green tea. So we're not talking about 1 cup to get those sleep benefits. We're talking about sipping on green tea throughout the day. So if you take it as an extract, L-theanine, widely available in health food stores, you can get away with taking a 200 milligram capsule. A study looking at Japanese males of all ages took 200 milligrams for 4 weeks, and then they had 4 weeks on a placebo. They noted increased verbal fluency and cognitive function, improved sleep, and reduced symptoms of anxiety and depression when compared with placebo. In another study, a lot of these are coming out of Japan, wonder why, 26 Japanese volunteers, 50 to 60 years old, were given a supplement with only 100 milligrams of L-theanine, but after just a single dose, they performed noticeably better on tests of memory and reaction than the participants who had popped a placebo. Green tea also has about 20% more antioxidants than black tea. One oxidant left behind in green tea that gets damaged in the production of black tea, they don't give us the name, but states that it helps kill off damaged cells and help reduce risks of cardiovascular disease. Now, black tea is richer in theaflavins and thearubicans, and these reduce the body's absorption of cholesterol. So maybe black tea at night when you have your high cholesterol meal, and green tea. And by the way, decaffeinated green tea has just as much theanine, so you can even drink that when you have caffeine sensitivity. And just one last story, I think, before we close for the evening. Scurvy is making a comeback. British pop star Robbie Williams revealed last year he had developed scurvy, a 17th century pirate disease, as he put it, caused by vitamin C deficiency. It made headlines around the world. Williams had been taking one of the GLP-1 weight loss drugs, like Ozempic, Wegovy, Mounjaro, and dietitians are now saying his case highlights a broader problem with the drugs. Researchers looked at all the major clinical trials of GLP-1s, more than 40 studies involving 50,000 people over the last 17 years, and they found that just 2 of these studies assessed dietary intake of vitamins, and only 1 had published data on what the patients were eating. Now, I'm going to digress for a moment and say, when a person has gastric bypass surgery, they eat a lot less, and there are certain vitamins that they don't absorb well, like vitamin B12. And we tell them you need to be taking vitamin B12 for the rest of your life. And after about 5 years, when you check in on them, about half of them have stopped taking their vitamins. Don't do that. If you're on GLP-1 medications, you absolutely need to be on a good multivitamin, because you will develop vitamin deficiencies. Most of the studies didn't even look at what people were eating, and I'm betting ice cream and cookies because, you're going to splurge when you're losing weight, even no matter what you eat, but you can't keep that up and shouldn't. Scurvy can cause all sorts of lovely symptoms: fatigue, arms and legs aches, bleeding gums. In later stages, you get corkscrew hairs, funny little twisty hairs growing out of your body and at the hairline in particular. Wounds don't heal. You start to get little blood clots under the skin, advanced anemia because you can't make blood, and then internal bleeding. And in the late stages, a stroke-like paralysis occurs. Portuguese explorer Vasco da Gama lost half of his crew to scurvy. It's very important to recognize that losing body weight quickly is a threat to your health, perhaps as much as the actual weight itself is. And we have to be prudent and look to our nutrition under these circumstances. Well, that's about all for this week's podcast. Please go to AskDrDawn.com for news about our future plans. For now, this is Dr. Dawn saying so long and stay healthy.
Ask Dr. Dawn is brought to you by Jiva Media. Production and editing by Charles Mansky. Music by John Scoville.